To all of our local, our regional and our international viewers, thank you kindly for choosing us here on Real TV, where we bring reality to you. I am Zelisa inviting you to stay with us. A warm welcome to another edition of Conversations with Zelisa, where we continue to inform, educate, empower and answer those unanswered questions. It's time to get your pen and your notebook, Real TV, so you could take notes on important numbers that will be helpful for you and your loved ones. Directing this morning and in master control, we've got London, Mr. London on board. And of course, we wish each and every one of you a beautiful, blessed, productive and great day today. Happy Thursday, my friends. It's Thursday, the 23rd of October, 2025. It is a day and time we will never, ever, ever have the opportunity to ever have again. So don't procrastinate, don't waste your time, do something productive and constructive with your time, all right? Time is of essence. And of course, if you're celebrating a birthday, happy birthday and an anniversary to you and that someone. Don't take life for granted, don't take loved ones for granted. Tomorrow is not promised. And let's go to our quote for today, London. Our quote coming to us with the kind compliments of Fab India Expo. And our quote says, progress has little to do with speed, but much to do with direction. Aha! If you have no direction and you don't have a goal, you can't have progress. It has little to do with speed, but it's about, having a goal and getting into the right direction and executing that the best way you know how to. Thank you so much for that. That came to us with the kind compliments of Fab India Expo. Let's go to the ad.
To the colors and flavors of India at the India in Style Expo opposite the Center of Excellence Mokoya. Dive into our Indian Food Festival featuring a delicious variety, plus explore vibrant Indian clothing, elegant outfits for the entire family, perfect for every occasion. Open daily from 10 a.m. to 8 p.m. opposite the Center of Excellence in Mokoya. Get ready, Shoguners! The Fab India Expo is back, starting on September 18th, right opposite the Medford gas station, Shoguners. Shop authentic Indian fashion, food, jewelry, home decor, and much more. Don't miss out on the Fab India Expo opposite Medford gas station, Shoguners, your one-stop cultural destination.
Welcome back to Conversations with Zelisa, where we continue to inform, educate, empower, and answer those unanswered questions. And as you know, this month is known as Breast Cancer Awareness Month. Can we get that little clip up, please, London? There you go. And so, in every scar there is a story of strength, and every survivor a beacon of hope. And let's go to the clip, please. And it's Breast Cancer Awareness Month, and we are very privileged and very blessed to have with us Dr. Mala Jilal. Now, Dr. Jilal is a consultant pathologist at the Eric Williams Science Medical Complex, and we're very pleased to have her, such a strength, a force to be reckoned with, to inform, educate and empower us when it comes to cancer and bringing awareness. Doctor, good morning and welcome.
Good morning.
And before we start our show and go into our conversation today on this Thursday, 23rd October 2025, Doctor is celebrating her birthday. Happy, happy birthday. All of God's choicest blessings. May all of your dreams and all of your desires be fulfilled. May you always have love and happiness and peace, good health, prosperity and growth, and continue to be a beacon of light in so many lives. God's choicest blessings. Happy birthday. And I feel very privileged to have you on such an auspicious day, that you take time to spend time to inform and educate about cancer. So have a great day.
I'm honored.
What a start. What a start of your day. Giving back. Not receiving rather, but giving back. And that just shows how humble you are and a gentle soul, and taking time on your day to educate people around the world. And we thank you. We're humbled by that. Cancer. understanding breast cancer. Before we even get into the conversation, the depth of the conversation, every morning I would post the guests that we are having for the day and the topic. And I got a number of questions. One came from a gentleman asking, and that's Janki. Good morning and welcome, Janki, and thanks for asking, thanks for viewing. He really wanted to know if men can get breast cancer.
Right, that's an excellent question. Yes, men can get breast cancer, though very uncommon. Breast cancer in males accounts for 1% of cancer that men can get, right? Usually it's the male will be of a younger age because it's associated with a hereditary cancer syndrome.
Okay.
Usually it's the gene BRCA or BRCA2 gene that it's associated with.
Right.
So we have to remember that men do have breasts even though it's non-functional.
Right.
Right? So they have the breast tissue,
Right.
and because of genes passed down from their parents, right, they can develop breast cancer.
Okay.
So because of the BRCA2 gene mutation, the breast cancer that they develop has a better prognosis compared to in a female.
Okay.
Yeah.
Thank you so much. Now, let's go into some of the early signs or we should be aware of, especially as women now, as we talk about breast cancer in women. Let's talk about some of the signs that we should, look out for. We should be aware. We don't take for granted. Very often, we have a headache and we take a tablet and we don't realize that, listen, if you have a headache, 1 day, 2 days, 3 days, 4 days, 5 days, you can't be taking tablets. Get to a doctor, get diagnosed, and prevention is better than cure.
Yeah.
So talk to us, Doc, about some of the signs that we need to be aware of, we need to look out for,
Right. So the first thing is any change in the consistency of the breast. So it's not always necessarily a lump, right? It's just a change, just a simple change in the size and the shape of the breast. So this is why self-examination of the breast is so important.
Right.
You don't wait until the lump appears, right? Another sign is obviously the breast lump, right? And changes in the appearance of the outside, so the skin of the breast and the nipples. So like a bloody discharge from the nipple.
From the nipple?
Yeah. A change in the skin where it can look like the outside of an orange. So a very wrinkled or dimpled look.
Okay.
All right, thickened. The nipple can change in size. Sometimes it can sink in. We call that an inverted nipple. The skin can show puckering in the area, like where the lump is.
Right.
Right. So usually the lump is painless, but in some women, the breast it looks inflamed, so it can be tender and red and warm to touch, almost like an infection. All right. So that is another way.
It feels warmer than normal.
Right. Yes.
Right. So you're getting that warmth in your breast. Like Doc said, a little wrinkly, you notice it's changing. I don't think it's because of old age. It could be, some people would sweep that under the carpet and think, well, I'm getting older and my breast's looking a little wrinkly. Right. And they don't look into it.
Right. So that's what, and then so you want to compare it to the other side, the other breast.
Right.
So you're looking for asymmetry, that meaning it looks different from the others. So that's why early examination, the literature advises examination from since you're a teenager.
Right.
So that you get to know your breast, basically. Because I always tell my students, you have to know normal before you could diagnose abnormal.
Correct.
So by starting the self-exams from a teenager, you'll be familiar where the little bumps and little things, familiarize yourself. So that when a new change occurs, you'll be able to identify it.
And so this message is directly now for mothers and aunties and grandmothers or the females in the home to have early conversations with your daughters with regards to examining how, teach them how to, and if you don't, you can Google it. That's the beauty, you know, about
Yes.
having
Yes.
this at your hands to use it to the best of your ability. And so it is important that you sit and have a conversation about these things with your daughters very early. Now,
Yes, of
how
course.
often should we go as adults to perhaps decide, no signs, but let me go check?
Yes.
Because perhaps the fear of a grandmother, an auntie, and a mother passing because of breast cancer.
Right. So that's screening you're talking about, right? So breast cancer is one of those cancers that there is a screening test for.
Right.
Right. So that's why this is so important.
Yes.
Breast cancer awareness is so important. Right. So screening is a test that you don't have any. It's a healthy patient that is going for the screening.
Right.
So no of these signs and symptoms we just spoke about.
Right.
So you're healthy. So what is recommended is from the age of 45, between the age of 45 to 70 years, at an interval of 2 to 3 years, you get a screening mammogram. Right? However, if it is, you know, you have a family history, so a first degree relative usually. So what is a first degree relative? So like your mom, your sister, your daughter, right? Those are first degree relatives. So then the advice is you want to start screening earlier than 45 years.
Good.
Right?
And that's great information. So if you know, as you said, mother, sister, daughter,
Yes.
aunt,
Yeah.
you need not wait until you're 45, but rather earlier, because prevention is better than, and there's no harm in going to check. There's no harm in ensuring that, you know, you do some tests to ensure that all is well.
Right, exactly. So if you're unsure when you should go, but you know you have the family history, I would advise you go to the health center or to your private GP, you know, whoever you're comfortable with,
Exactly.
and get advice on when you should start seeking
I am happy
screening.
that you mentioned you could go to a health center, because the tests and the doctors there are absolutely free. There's no cost attached.
Yes.
You join the clinic and they take care of you. That's the truth. Or you could go to your private doctor, your GP, if you feel more comfortable
Yes.
than one-on-one, because it's a sensitive thing.
Yes.
And so you go to your GP as well. You know, you're welcome to do that. But I always say prevention is better than cure. Let's go to these important messages. You are viewing Real TV. This is a program, Conversations with Zelisa. All those of you on the Tego app, remember to tell your friends and family, download it and take it with you wherever you may go, so that you could always look at our programming firsthand. Let's go to these important messages. Stay with us.
Every word, every line, every paragraph depicts a real moment in someone's life. A father, a sister, a mother, a brother. We at Newsday are dedicated to you, the people, and through independent, unwavering journalism, strive to always bring your stories to life. Because your stories are more than just words. Newsday, independent and credible.
Transform your space at Mirage Wholesalers Limited with our exquisite range of crown moldings, skirtings, chair rails, architraves, medallions, corbels, and more classy embellishments. And now, discover our new joinery material, including PVC sheets, two-sided white melamine, and plain or moisture-resistant MDF sheets. Visit us today at Tidco Industrial Estate, Caroni, or call us at 645-9588.
At Ramsaran Dairy Products, we're all about freshness, health, and pure enjoyment. Our drinks come in pure paperboard cartons, clean, safe, and eco-friendly, because caring for you also means caring for our planet. So skip the plastic and styrofoam and choose a healthier lifestyle with Ramsaran's biodegradable packaging. Indulge in our creamy, smooth, and delicious peanut punch and soursop milk drinks, made with real goodness in every sip. And don't forget our refreshing orange, pineapple, and Mauby dairy drinks. each one carefully crafted for your pure enjoyment. For sales and services, contact us today. Give us a call, send us an email, or visit us at Lot 15 Label Boulevard, Trin-City Industrial Estate. Ramsaran Dairy Products. Pure taste, pure care, pure you.
Welcome back to Conversations with Zelisa. We understand, we are aware, and it is Breast Cancer Awareness Month, and it is important that we discuss it and not discuss it. It is important that we have open conversations. It is important that we continue to educate ourselves, because knowledge is power. And when we have knowledge and we are aware of things, we make better choices and we have a better tomorrow, and prevention is always better than cure. So we are very pleased to have with us today Dr. Mala Jilal. She is a pathologist and she works out of the Mount Hope Hospital, and we're very pleased. She's also a lecturer. She teaches as well. So she's very competent. When you talk about a walking institution, we're talking about Dr. Jilal. And today she's here to inform, educate and empower us about cancer and being aware of it. And if you may have any questions or any concerns, please feel free to call in, or you could send me a WhatsApp and doctor will be more than happy to advise you accordingly, all right? And take notes, right? Doc, so we spoke about perhaps some of the signs, and let's now get into understanding, because there are different types of cancer now. Talk to us about the types of cancer. How do we identify? What should be the first thing we should do once we did our tests, the results came back, and you find out you're test positive? What happens?
So you present yourself for the screening mammogram, and the doctor discovers abnormality on the X-ray. That's what a mammogram is. A special type of X-ray.
Right.
Right. So the next step would be you'll be referred. So this is usually primary care level.
Right.
So your health center, your general practitioner.
Right.
So the next step would be to see the specialist. So that's where you go to your Mount Hope, for example.
Right.
So that's your secondary and tertiary care institutions,
Okay.
right? So you'll be spoken to. So that's called a clinical history. The doctor will take a clinical history from you and do an examination, and he could opt to send you for other tests, for example, an ultrasound. Okay. Or an MRI. Okay. So then further to that is a biopsy. It's a needle biopsy, a small needle that they would insert into the breast lump.
Into the area.
The area. Okay. So if it is palpable, meaning that it's superficial and the doctor can feel it, they can do it in an office setting, right, in an outpatient setting, or if it is not palpable, so they would need some imaging to act as the eyes to take the biopsy.
Okay, so
right?
It all depends on the position of the lump.
Right. Yes.
Okay, understood.
Right. So the next step now, so they will take about maybe 2 or 3 cores of tissue from a needle. Right. So a core, it looks like the tissue from the
And
the
does
lump.
that take any anesthetic or anything of this sort?
Yes. So they will give some local anesthetic
to numb the area.
To the area.
Okay.
Yeah. Right. It's not a big surgery or
And it's not painful, is it?
Right. It minimally.
Okay.
Right?
Okay.
So the purpose of it is to get a few cores of tissue to send to the pathologist. So that's where I enter.
That's where you're okay. Excellent.
Right. So the tissue then undergoes special staining. And I look at it with my microscope, a light microscope, and then I will confirm that is the definitive diagnosis of cancer. And only I can do that. The pathologist, that's what I mean.
Yeah, no,
right?
of course.
So
yes.
that is the definitive test
Yeah.
to confirm that there is cancer, right?
And once you can, may I ask, you can also or will determine how aggressive it is, or perhaps how, as we would say, how big it is, how small it is, things like that. That's your job to determine those things, to give those answers.
Right. So, well, that is a clinical and pathological assessment. So the imaging will give us a size, because remember, I only got a small representative
Right.
at this time, right?
To
with the
determine
biopsy.
if it's positive or negative.
Right. At this point, this is diagnosis,
Good.
right? So it's a small piece of tissue.
Right.
It's not the entire
Right.
lesion,
Okay.
lump, right?
Good.
Right. So the next step, once cancer is confirmed, the most common type of, when you say breast cancer, there are many ways to classify cancer, right? So I don't want to get too technical,
That's
but
fine.
the most common type of breast cancer is invasive ductal carcinoma. So that is based on a histological or tissue diagnosis.
Okay.
Right? So about 80% of breast cancers, that is the histologic type.
So that's most common.
Yes, so
Okay.
it could be abbreviated IDC, invasive ductal carcinoma. The next step now would be to do special staining, special tests called immunohistochemistry to determine the biomarker status.
Okay.
So that is very important because it will help predict the response to different types of treatment that is will come.
So the patient will have options in terms of treatment. So you're going to have
Yes.
options. Okay,
Yes.
understood.
Right? So your treatment options will vary from chemotherapy, from
Which is common and we
hormonal
all
therapy,
know.
right?
Right.
Okay, hormonal therapy.
What is hormonal therapy?
Right, so that is where the biomarker status comes on.
Yeah.
So the cancer cells of the breast, right, they express receptors. So your estrogen receptor, your progesterone receptor, and something called your HER2 receptor.
Okay.
So these are the three receptors or biomarkers that we are testing for once you are confirmed that you have cancer.
Okay.
Right? So the ER, most of the breast cancer, good news is that they are ER and PR, estrogen receptor and progesterone receptor positive.
Okay.
Again, 80% of them will be, that is their profile.
What is the 20%?
Right. So the 20% would be, they will vary. So they
Okay.
could be negative, okay, and HER2 positive, or all three biomarkers will be negative. And that is the most aggressive type of breast cancer. All right, so you can have a combination of positive and negative within the three markers.
Understood.
Right? So if you are ER and PR positive, which most breast cancers are, you are eligible for hormonal therapy.
Okay.
Right? And if you are HER2 positive, that's the third biomarker, you are eligible for a special type of chemotherapeutic agent specific to that receptor. Right? It's a special type of antibody that directed against that receptor.
Now you are a pathologist, trained and certified, practicing. I will ask you, there are people who would say, no, I am not going to do any chemotherapy because of the ills they've heard, or perhaps understanding properly because of what this one said or the experience another person would have had. Not perhaps doing any research at all, but already closing that door to say, no chemotherapy. And they would probably decide to go the natural way, using natural herbs and things like that. What are your thoughts on that?
I
your years of experience, huh?
Well, I obviously do not advocate going the natural route, whatever that may mean for you. These drugs that we use, right, that the oncologist would use, prescribe, comes with clinical evidence, right? It's backed by years of research, right? So there is science behind it.
Right.
Right, which is why this is all standard of care.
Yes.
We are following the American or European standard of care.
Understood.
So well, I follow the American standard in terms of my reporting.
Yes.
So whatever the parameters I give in my pathology report, the oncologist and the surgeon need it to decide what is the best treatment. It's not just in purgatory. It has a reason.
Correct.
So I report on this biomarker status because it has a implication.
Right.
Right, and that affects how the patient will progress, the prognosis therefore. So my advice would be, you want to go the natural route, you can do that, but in addition to what is the standard treatment, what is advised by your doctor, right?
Doc, I interviewed a friend of mine, an acquaintance. She's a singer, and she was diagnosed with cancer. She removed her breast. She's singing as normal now and living life. She celebrated her daughter's wedding recently. She performed in so many functions just for this Diwali season. So she's continued to blossom and live life very richly in a full way. I mean, she doesn't have her breast. You look at her, you'd never know. She doesn't have her hair. I think it's growing back a little, but she's learned the art of using wigs and things like that. And she's as beautiful as ever, and she lives a full life.
Right.
So all is not lost.
No, I think you have to weigh the pros and the cons whenever you're discussing the treatment option.
Yeah.
So whether it be surgery, chemotherapy, hormonal therapy, radiotherapy, you need to weigh your pros and cons. That is why the discussion with your doctor is so important.
You're absolutely correct. You should have that confidence, and also that, I don't want to say connection, but you must be able to ask questions and feel safe. Feel not intimidated, but rather feel comfortable enough to sit with your doctor and consult, ask questions. Ask and you shall receive. And it's okay if you don't understand something. It's okay if you feel you don't feel yourself, and you feel it's a very sensitive matter. It's quite fragile.
Yes.
So it's important to be able to sit and consult with your doctor. It's also important to sit and consult with your partner in life, your children, your family. You allow and have conversations, and that way you yourself will feel better. You feel loved, and you have that support is so important. Especially from your partner, because as a woman, hearing that you've got breast cancer and then having to lose a breast, or perhaps two of them, it's something that you'll have to perhaps get some sort of counseling, I would say.
Of course, yes.
Because you feel as if you're not as beautiful or less than who you are. But life goes on, and it's okay to have that option, to understand that you want to continue living life with your loved ones. This is a program, Conversations with Zelisa, right here on Real TV. Let's go to these important messages. Stay with us. When we return, we continue our conversation with pathologist Dr. Mala Jilal. Stay with us.
On Saturday, 25th October, at the Center of Excellence, Massive Tank Sound Company brings to you a night of Bollywood magic, featuring the Big B of Gujarat, Bankim Pathak.
I'm coming fourth time in this your country with the lovely songs of Muhammad Rafi Saab. This time I'm coming with the full team of my musicians and singers from India.
Daksha Goyal, Indian Idol star, Shivanji Sharma.
Hey guys, this is me Shivangi Sharma, and I am coming to Trinidad for the very first time.
Nitin Kumar.
See you on 25th of October in Trinidad Center of Excellence. Thank you so much. Radhe Radhe.
Tanmay Chaturvedi.
This is Tanmay Chaturvedi, first runner-up of Saregama 2018.
Get those general tickets $200, VIP $500. For VVIP, call 498-1698. Ticket outlets, all extra foods nationwide. Prem Singh's Curap and Shagwanas, MS Food City Debe. Saturday, 25th October, at the Center of Excellence. A night of Bollywood magic.
Looking for a full-time secondary school where your child feels safe, supported, and inspired? Experience the difference at Upper Level Educational Institute. Our passionate teachers and interactive classes ensure students remain actively engaged and excited to learn. Classes are also available part-time for students, repeaters, and adult learners. Sign up for any part-time subject and get CSEC Math free. Upper Level, a great place to learn, where students come first. Register today.
Mirage Woodworking has expanded, and we're just getting started. Now introducing 5.5 and 7.5 millimeters SPC flooring, WPC door sets, draw slides, hinges, and more. All at unbeatable prices. Call or visit us today.
You're viewing Real TV. Thanks for choosing us.
Welcome back to Conversations with Zelisa right here on Real TV, where we bring reality to you. My dear friends, we recognize and understand this month is Breast Cancer Awareness Month, and I am in conversation today with Dr. Mala Jilal. She's a pathologist and she's talking to us about cancer, breast cancer. Welcome back, Dr. Jilal.
Thank you.
You know, I think what is important is that once you identify, okay, and you understand and you start that I've been diagnosed with breast cancer, you start your treatment, of course by the advice of your doctor, your consultant, you consult. It is important that you don't procrastinate. You get the ball rolling and get things done for the best of your interest. Yeah, I want to talk a little bit about diet, and would our diet in any way, you know, if you smoke and if you drink, you could have heart problems. You understand, is there anything that we could be aware of when it comes to breast cancer or cancer in general that we should or should not have?
Right, so that will come under your risk factors for breast cancer.
Right.
So the risk factors for breast cancer can be divided into things that you cannot change. So that's non-modifiable factors and things that you can change. So your lifestyle or modifiable factors. So your non-modifiable factors would be things like your age. So breast cancer typically is a cancer of, you know, the more mature female.
Yeah.
So between the typical patient would be between the ages of 50 to 60 years old,
okay,
who is affected with breast cancer.
Right.
Right. So your age, being female, as I said in the beginning, females, breast cancer is the most common cancer in females.
Okay.
All right. But we know it can also occur in men.
Yes.
Right. Okay. So and your genetic, your hereditary, the genes that you inherit from your parents, you can't change that, right?
I want to go back a little bit, Dr. Jilal. When you talk about, or we go back to men having cancer, breast cancer, now we know with women it's traditional, they have the option of removing the breasts or breasts, right? Do you then go internally into men and remove the lump?
Right, yes, it's the same procedure, the same advice, because so once you know that you are at a higher risk for breast cancer because you inherited the BRCA genes, right? What the advice is the woman, either they start screening early, well, patients, let me stop saying woman, right? Since we
are talking about men as well, yes.
Right, so, but they can be offered prophylactic mastectomies to remove both breasts.
Right.
Right? So this procedure reduces the risk of developing breast cancer to about 80%. So being born with the mutation in the BRCA gene, your risk for cancer goes up to 60 to about 90%. Whereas in the normal population, like persons that didn't born with the mutated gene, their risk is 1 in 9, which is about 11%. Right? But if you are born with the mutated gene, that risk goes up to 60 to 90%.
Understood.
So prophylactic mastectomies can assist by bringing down the risk to about 8%, which is lower than the average population, which is 11%.
Okay.
Right? So that is one of the risks, one of the advice for women or men that are born with the mutated gene.
Understood.
Right? With respect to the other risk factors that I spoke about, so those were the things that you cannot change, right? So the things that you can change are your lifestyle. So that's like your weight. So being obese or overweight is associated with increased risk for breast cancer, increased alcohol consumption. So diet would come in because you don't want to get, being overweight, right? So that is where that would factor in. All right. Also, having an early menses, starting your periods early, and a late menopause. Right? Yeah, so your estrogen exposure is greater, right? Also, not having children, so nulliparity, and things like, smoking as well, and there are certain medications like hormonal replacement therapy that postmenopausal women use, and there is a link with the oral contraceptive pill as well. Yeah.
Now you've given us a lot to think about, a lot of food you fed us there. People often are upset. Now I don't approve of fat shaming. I don't approve of it at all, right? Because people are obese or overweight for many reasons.
Yeah.
But I also feel like when you talk about now obesity and breast cancer has a link. When we talk about health concerns in terms of heart problems and diabetes and things like that. So it's about being healthy, not about being fat or overweight. It's about making a conscious effort or a choice to have a healthier lifestyle.
Yes.
And what you take, what you eat, because you really are what you eat.
Right. So that's why the diet and exercise
so important.
So it's not just breast cancer.
You're correct.
You can relate it to even the non-communicable diseases like you mentioned, diabetes and hypertension.
Exactly.
Right. So it's so important to have just practice a healthy lifestyle
in general. When we say eat healthy, live healthy, this is what we talk about. Prevention is always better than cure.
Yes.
So some of the foods directly that should perhaps not have or have.
In terms of for breast cancer,
yes. Anything in particular?
I am not aware of anything in particular, but I do know that there are studies that say breastfeeding can help protect against breast cancer, and I remember using certain types of tea with fenugreek. Could aid with the lactation. But I'm not familiar with a particular food.
So breastfeeding is prescribed. It's
right.
And it's the best milk. It's the best nutrients you could give your child. That's the truth,
Right.
Second to none.
Right. Yes.
So breast milk is the best milk, as we've learned and traditional over the years. Yeah. Proper balanced diet, exercise.
Yes.
Low alcohol or no at all, no
smoking.
Right. I think it comes down to the personal choices we
right.
make in life.
Yes.
And now with the budget that alcohol is up there and cigarettes up there, then it gives you now the chance to not smoke and not drink. make better choices with your money and live a healthier lifestyle, you know. If you save that money, perhaps you could take your family on a little vacation at the end of the year. You know, people need to be wise in the choices that we make. You know, you cut off those things, you put yourself not at risk, spend your money wisely.
Yeah, you live long.
You live healthier and longer, you're supposed to, but make the choice to do that. And we're all in control of that. So we understand now with regards to how important it is to eat healthy, how important it is to do exercise, regular exercise. And exercising, as I said before, ladies, some of you feel when you clean the house, sweep and mop, that's exercise. It's not exercise. Go around the block, run around your house if you don't feel safe on the outside. Walk upstairs, up and down. Put on music and dance. You know, get yourself active. That's proper exercise where you're sweating.
Something consistent.
Exactly, Doc. And I think with the lifestyle we have now, not many people choose to exercise. They take it for granted.
It's recommended like at least 3 days a week, for at least about a half an hour.
Doc, before we go to the break, perhaps a little bit about prevention.
Okay, so that is again where screening is so important. As I said, screening is for the woman. You don't have any you're a healthy person, you don't have any signs or symptoms, no breast lump, no change in the consistency or anything. So that is where how you can facilitate prevention by screening, all right, which begins at age 45, continues until 70, all right, at an interval of 2 to 3 years, all dependent on what the doctor advises based on what is seen on the screening mammogram.
Great.
If you know you have a family history, you start earlier. So it's important to find out what is the illnesses in your family. Go talk to your previous generations and find out if anyone died at an early age from breast cancer or ovarian cancer or pancreatic cancer or prostate cancer. All of these cancers are linked by the hereditary cancer syndrome I had mentioned.
That's great information you just shared there with regards to doing do a little research into the history, your family history and their health. So that as we continue to say prevention is better than cure. I like the fact that you also said to us earlier, prior to 45, sit and talk to your daughters. Talk to them. That is such good information about examining themselves when they take a bath or whatever. And if they feel something strange or they whatever, talk about it immediately. We are in control of those things.
Yes.
You know?
Yes.
We are in conversation today with Dr. Mala Jilal. She's a pathologist and she's talking to us about breast cancer. We're going to take a quick break. Let's go to these important messages. When we return, we continue our conversation with Dr. Jilal. Stay with us.
I went to college abroad and my roommate Samira would always make the best chai tea for me. But no matter how hard she tried to teach me how to make it, I could never make it from scratch. And when I came back home to Trinidad, I found myself missing that chai tea taste. I could never recreate it again.
But when I went to the supermarket, I saw the GB's brand.
And they come in 3-in-1 and 2-in-1 packs. And all I had to do was add water and I got that same chai taste again. I'm so glad I found it.
Trust me, after watching this, you'll never make chai in the same old way again. Since the time I can remember, chai at home was always made the same way, just like it probably is at your place too. Me, my mom, my grandma, everyone followed the same process. Turn on the gas, boil the milk, add tea leaves, spices, the full ritual. Until now. Last week, I was at Ria's place and she made chai in just 30 seconds. And it tasted amazing. Her secret? GB's Chai Gold, instant tea premix. Just tear open a sachet, pour it into a cup, add hot water, stir, and that's it. Chai, ready. Now I only prefer GB's Chai Gold. No mess, no stress, just perfect chai. Every time. Trust me, try it once, you'll never go back.
Every word, every line, every paragraph depicts a real moment in someone's life. A father, a sister, a mother, a brother. We at Newsday are dedicated to you, the people, and through independent, unwavering journalism, strive to always bring your stories to life. Because your stories are more than just words. Newsday, independent and credible.
To all of our local, regional and international viewers, thank you kindly for choosing us here at Real TV, where we bring reality to you. You know, my friends, this month is known as Breast Cancer Awareness Month, and it's important that we recognize and understand how important it is for us to make a conscious effort to check, to talk to our children about checking themselves as well, having that conversation, because as I like to say, and it's important, prevention is better than cure. And knowledge is power. And now that you have the knowledge, please be aware of the consequences if you don't nip it in the bud, if you don't get it at an early stage, all right? Today I'm in conversation with a pathologist, Dr. Mala Jilal, and she's here talking to us about breast cancer. Dr. Jilal, I want to talk a little bit about people who are fearful of chemotherapy, and they may say, but it's awful, it's terrible, I lose my hair, I lose a lot of weight, you feel terrible after. Is this something that I have to do for the rest of my life?
Right. So no. So the chemotherapy, as I said, is targeted towards the receptors, the biomarkers that I had mentioned before, the ER, the PR, and the HER2, depending if they are positive or negative, right? So the oncologist, so this is, you will meet the oncologist, right? So this is outside of my scope, but basically the chemotherapy is administered in cycles for a duration of time. Right? And because it's a drug, like any drug, whether it be natural or prescribed, it will have side effects. So what you have to do is you have to weigh the pros and the cons, right? So the con being, if you do not take the medication, what is your survival rate, right? Without it.
That's what it comes down to, you know. That is what you have to be honest about it with yourself.
Right.
This is reality, and you have to deal with it. You can't procrastinate, you can't cry about it. I mean, of course, when you're in it, you know what it feels like. But the fact is, it's either you choose to die or you choose to live. It sounds harsh, but it's real. It's reality, and you have to face up to reality.
Right. So that is why the conversation with the oncologist, with the surgeon, is so important.
Right.
And as you mentioned, in addition to that, your family support. Yeah. Because the drugs will have side effects because it's targeting rapidly dividing cells. And unfortunately, you have rapidly dividing cells in your gut, in your hair, in your skin. So that is where the side effects come in, because it's affecting those cells as well. You know?
Now, you use the word rapid, right? In terms of not dealing with this early or being aggressive, because you need to be aggressive, the individual, you need to be aggressive. Let's talk about spreading to other areas.
Right. So breast cancer, it likes to go to other organs, and in fact all cancers, that's why it's malignant, right? So it's like a rogue cell or rogue, like a rogue person that doesn't obey the rules, right? So that is what a cancer cell is. It doesn't listen to the normal cell signals, right? Its microenvironment, it doesn't listen anymore. So it just produces and proliferates and takes over wherever it is, right? So in this instance, it's in the breast. And then it will want to go and take over the entire body. So breast cancer likes to go to the lungs, to the liver, to bone and brain.
Wow.
Right? So after you were diagnosed with breast cancer, with the biopsy, the next step would be to stage it, to find out where, if it has spread, if outside of the breast, right? So you would do that by doing further radiological tests, so CT scan, right? What people know as the CAT scan, right? So you would do a CT of your chest and abdomen, right? If your doctor thinks your brain is involved or your bone is involved, you do a CT of the brain or a bone scan to determine if there are masses or lesions in those areas.
Dr. Jilal, I'm going to come to the point. There are people that say they have to wait for months, or some people complain about a year. I've heard it, right? With regards for tests at the hospital. Within that time, they could die because it can spread aggressively. You have the option then of doing it privately. We've got many private clinics that treat. Am I correct?
Yes, that's correct. Unfortunately, you're right. The waiting time is long. But the tests are available. The CT scans, the biopsy even, can be done at private labs, at private institutions, yes.
So you do have that option, because I think in a situation, my perspective, in a situation where you know, you've got to work on things, you yourself need to make decisions to be aggressive, and every day matters.
Yes. Yes, it does. But even though the waiting time may be a little long, we do have very competent, very caring doctors in all the fields. I can speak for myself and my colleagues that we try to move as quickly, our turnaround time, you call it, as quickly as we can. Okay, so I don't want the public to feel like...
Yes. No, you all are there, and I mean, I know Dr. Marissa down at the and the cancer, and she is amazing, Dr. Nirmal.
Yes.
She's been brilliant. I mean, she is one of the most, what should I say, she's just a bright light, and she was born to do what she's doing. Like you, you have people that are very caring and very nurturing and understanding, and they've got that compassion. And it's because it's not a job that you do, but rather you love what you do.
Well, I do. I certainly could sit behind my microscope and diagnose all most of the time.
And it's because you love doing what you do, and you do it with a passion.
Yes.
And that is what sets you apart from others. Right. You know? What do you say, what would be your advice today as a pathologist to our citizens when it comes to breast cancer and awareness?
Right. So my advice is prevention is better than cure. And it's cheaper as well. So my advice would be to talk to your relatives, find out what is your family history, right? The next thing, go to your screening, go to your primary care physician and get screened by having a mammogram, okay? If you do discover a lump, 9 out of 10 times it's going to be benign, so don't freak out. And talk to people who are survivors, right? If you are diagnosed with breast cancer, you speak to people with survivors. You know, there are websites like the Cancer Society of Trinidad and Tobago that are great resources to provide support.
I think your advice and your message is extremely important and very deep with regards to finding out and understanding yourself. Once you have the knowledge and the understanding, you can then relate to what's happening yourself rather than second hand or not being sure of what's going on. Knowledge is power. And if you have the knowledge of, okay, you do a little research like you've said, and you know exactly, okay, this is what's happening, this is what expected, and so you are prepared mentally. Another thing that I think that is important that you shared with our viewers is the fact that you need to have that support, that family support. Sure. I would also go the extra mile and say, God. Ask God to take control, because the fact is with God all things are possible. You release the burden, you release the problem, you release the hurt, the disappointment that you're feeling, and concentrate on fixing yourself. You follow? You concentrate with that power of the mind, of your thought. You know, you put your energy rather than, I know it's hard and it's difficult because it's a hard pill to swallow. Very hard. Out of the blue, one day you realize you take a test and that's it. You have cancer. We know what is inevitable. But it's also inevitable that the day we're born, we start dying that day. That's the fact, you know, Doc.
That is true.
So the truth is, we are in control of the now and how we deal with things.
Yes.
Your emotions can get the better of you, but your emotions can also kill you faster. So the faster you realize, hey, I'm in control of this, my doctors are going to take control and my master doctor is going to work, and it will all be fine. Your closing comments.
Just to remember that the screening mammogram is important, because not because we're saying so, but because it can detect a breast cancer 5 years before it becomes a lump. Right. That's why it's so important.
That was such a wonderful advice, because it comes 5 years. You can detect it 5 years ahead
before
of time.
it manifests as a lump.
Wow,
in
now
the
you
breast.
understand how important it is.
Right, and again, just talk to your family, know your family history, right? Don't just gossip about, you know.
You're correct. No, you're correct. Find out, how did my grandmother die? How did my auntie die? What was the reason? What was the cause? And again, knowledge is power, prevention is better than cure.
Yeah.
Doc, I want to thank you kindly for you spending your morning here, your birthday, with us on Conversations. I want to thank you for sharing your wealth of knowledge and experience as well. And I hope I am more enriched in knowledge and understanding and the seriousness of this, and I'm sure our viewers are near and far. I wish you the very best. I trust and hope we could have more conversations with you as a pathologist, so we could understand exactly, you know, when it comes to our health, your health is your wealth.
Yes, 100%
So
agree.
God bless you. Have a great day. Thanks again. We're full of gratitude and thanks. And I know we're going to have more conversations with you. Thank you so much.
Thank you.
You're welcome. Take care. This is where we're going to wrap things up. Remember, your health is your wealth. You are in control. Keep smiling. Be positive, and always know the best is yet to come. Be good law-abiding citizens. And more importantly, always know that with God and only God, all things are possible. All right? I am Zelisa Budu Singh Rupani. Stick and stay with us. For those of you that won your gifts and prizes on Diwali morning on the giveaway segment here, remember to come. You have until tomorrow to come collect your gifts. All right? Thank you so much for choosing us here at Real TV. Be safe. Be happy. See you tomorrow.